Hello, everyone. Welcome to the SavvyCast. This is Jamie, and I'm so thrilled that you're here today, whether you are watching on YouTube or listening to the podcast. I am super excited about today's topic and today's guest. I have joining me today, Dr. Paul Koch of Koch Aesthetic Dentistry. He is an expert at many things, but mostly how to make you have your most beautiful smile. And there are many, many angles that cosmetic dentistry can take. There's so many different things that we're going to address today. But first of all, I just want to say, Dr. Koch, thank you for joining me today on the SavvyCast.
Well, it is my absolute pleasure, and thank you so much for inviting me. This is really exciting, and I love to be able to talk to large numbers of people to help them learn about the things that we do and just what's possible, because so many people come in and they just don't know.
Right.
So
right.
it is my absolute pleasure to be here.
Well, I'm thrilled. And as I sit here drinking my iced coffee, that's probably something we're going to talk about, whitening and teeth and so forth. I want to start by asking the icebreaker question. What would you choose as your last meal?
All right. So as I think about that question, to be very, very honest with you, I use food more as a means to an end. The food itself is not the most important part of my last meal. It's who's at the table with me. And I could literally have a frozen pizza heated up as long as I'm with my family and the people that mean the most to me. So the meal itself is honestly inconsequential to me, but the people at the table matter a lot.
Okay, that's probably one of the best, most deepest and profound answers I've gotten. That's wonderful. I love that. Well, let me just, before we dive into all the topic, I just want to tell everyone how you and I connected. We actually have been going to the same church service, the 8 o'clock service at our Grandview campus, Church of the Highlands. I don't know. You've probably been there as long as we have for, over a year, because the campus, the new building.
That's right. High five for the early church people.
Oh my goodness, yes. We're the most spiritual. That's what that is.
That's right.
But anyway, so we sat in front of you, Zane and I. We'd never had a conversation. And then you and I realized that one of my favorite people in the world, Deanna Pizitz, Well and Worthy Life, that you actually are her dentist. And we had the conversation and I found out you had been on her podcast. So I said, oh, please be on mine, because there are so many questions that I have that I feel like many other people have. So this is going to be a great conversation. So I would just like to start by asking you, describe what your practice entails. Koch Aesthetic Dentistry. Okay, let's just tell everybody, if they're looking you up, your last name is not spelled like it sounds. It's Koch. Yes, but it's Koch. It's Koch. So I apologize for that. But
so the derivation, it's originally German, and so my great grandfather pronounced it Koch with the heavy throat thing. So when he came over to this country, it became Koch very quickly. Well, that's how we pronounce it. But
okay, well, Koch Aesthetic Dentistry, I know you have patients from all over. I just saw on your Instagram recently, Miss Utah. Tell us, just in a nutshell, give us an overview of your practice and the things that you do for people.
So it's actually really interesting, and all day long, even though I have different tools in my tool belt, I'm solving problems. So sometimes the problems are related to someone has a smile that they're not happy with. Sometimes it's a health related problem. There's something that hurts. They can't eat properly. They have sensitivity. Sometimes it's related to a lifetime of worn teeth. And so there are problems associated with that, with teeth breaking, and that sort of thing. And then, of course, we do facial aesthetics as well. So sometimes when we sit down and we have a full photography studio here where we can take pictures of a person's smile, face, and we'll put up this smile on our monitor, and the first thing someone wants to talk about is their eyes or their lips. And so we're able to, and really every treatment that we do is focused on what's most important to that patient. And we're not a high volume practice because I spend a tremendous amount of time with each individual person trying to develop their unique plan in order to solve whatever problems we're setting out to solve. So that's what I do every day, which is great. The one other thing I'll just add that makes us unique is that we do a lot of sedation dentistry too. So when someone comes in, whether they're local or they come in from another state or another country, sometimes we're able to do a lot of dentistry in a short amount of time because we use different medicines to help them relax while they're here. So it's not unusual for us to do 20 teeth at once, 24 teeth at once, which, if you think about that being awake is even overwhelming to think about. But we do this 3 or 4 days a week, and people are able to solve a lot of problems very quickly as we go through this process.
Okay, so sedation dentistry, does that mean they're like put to sleep, like if you're doing a root canal? I'm sorry, wisdom tooth extraction, whatever that is, you're not like completely out, but you're asleep. Is that what you're talking about?
That's right. There are different levels. So the most shallow is what we call conscious sedation. We use oral medicines. We use pills to do this. Been using it for over 30 years in different ways. And people can relax, and in many cases they fall asleep. But the key is that every patient is maintaining their own airway, which is how we do it safely. Once you go deeper, you have to support someone's airway, and that's where it gets a lot riskier. So we don't go there. But oral surgeons routinely do, like for wisdom teeth and things like that, and they're well trained in that space. But we stay more shallow. But in most cases, the medicines that we use also cause people to not remember the experience, which is also great. So when you think back, you might as well have been sleeping because it's like a blank.
Right. Well, okay. Explain what the dental spa is. That's on your Instagram. Does that just entail what's involved in that?
So just like when you go to a spa, there's a lot of focusing on all 5 senses, right? So the sense of touch, we use warm blankets. We use things the noise canceling headphones. So we're trying to appeal to all of the senses, and we're focusing on making sure that each patient has just a wonderful experience. So rather than us being a service business, we're more of an experience-based business, which I think is in an effort to redefine what it means to go to the dentist. You may know this, but historically, people wouldn't get real excited about going to the dentist.
No.
And
no. But I'm sitting here listening to you thinking, okay, I'm about to book an appointment. This sounds wonderful. My goodness. I've never heard anything like this. Is this extremely unique, or?
I would say that it was, especially when I set up. So I've been in Birmingham for 23 years. It'll be 23 years in September. And I moved here from Atlanta, and we decided that when we set up that we were going to create this atmosphere. My wife actually started a business at the same time called Dental Spa Concepts, because we were learning where to order all of these things, and she thought, well, this is there's a market here, because a lot of people are trying to create a more pleasant dental experience. I always tell people that I don't want to be your bad memory one day.
Oh my goodness, that is amazing. Okay, so I want to ask, before we get into some of the specific things, are the procedures that would be done anywhere, but that you're making more pleasant, your insurance still is going to cover the procedures, but it's just if you're willing to out of pocket, I'm sure pay for the spa aspect of it. Is that correct?
It's a little different than that. I would say that a lot of what we do is the best model to kind of think about is like the plastic surgeon.
Mm.
So even though they're doing medical procedures every single day, the insurance companies have decided that those services will not be covered. And
Mhm.
so, like in many cases, veneers are not a covered service
Mhm.
by most dental insurance companies. Whitening, for instance, is not.
Mhm.
In most cases, the sedation is not.
Right.
So and the other thing too that often comes into play is when a dental office signs up to be a provider for that particular insurance company, then they are treated, a one way versus a dental office that is
Mhm.
not part of the plan. So
Mm.
it's important to kind of have that discussion on the front end wherever you go, just so
Mhm.
you know what's going to be expected.
Right. Okay. Well, I want to start with something that was really life-changing to me, veneers.
Mhm.
And it's sort of funny how I think some people just teeth are not, they don't understand. I was one of these. I didn't really understand how important teeth were. And I think, and I was young, married. We were maybe married 10 years. And I was asking Zane, I said, you care if I get Botox? And he is always so kind and gentle and everything that he said, but he says, honey, I don't mind if you do that, but I think the best thing you could do is start with your teeth. My
Mm.
teeth were not good. I never had braces growing up, and they were yellow, they were crooked. I mean, they weren't horrible, but they just weren't good. And he gave me a gift of veneers. And I'm telling you, it's life changing. It's
Yeah,
life changing.
absolutely.
And so
Absolutely.
talk about that. And I know it's widely recognized now, but just dive into that. Like, what is the ideal candidate? Are there things that maybe you might want to know before you start researching those?
Sure. So first thing that I would say is that every time it's been studied, male, female, and all age groups, when we meet another person, the first two things that we notice are their smile and their eyes.
Mm,
Okay.
mhm,
So obviously it's a great way to make well, either a great or a poor way to make a first impression. No matter what your smile looks like, you're going to make a first impression.
mhm.
And so it sounds like your husband was kind of saying, this is kind of your
Yeah.
first impression.
Mhm,
And he felt like that would be more important. And I think rightly so,
mhm.
that the areas that you were concerned about with Botox, you nailed it by focusing on your
Mhm.
smile.
Right.
So that's number one. Now, we actually use, and I would say this isn't well understood, but we use veneers for a lot of different applications. So the cosmetic approach is certainly one of them. Okay. So we can change a smile. I treat adults only. And so most of the people that I treat have had braces before. So
Mhm,
even if, we could use Invisalign or we could use orthodontics to straighten the teeth. Usually they're also worn and often
mhm,
they're darker than what
mhm,
people want. And people, nowadays want more of a quick fix.
mhm,
4 weeks of the process versus 2 years of orthodontics, for instance, and
mhm,
still that doesn't address the wear. It doesn't usually address the color.
mhm,
So veneers are a way that we can literally design and engineer a new smile.
mhm.
So, I kind of mentioned the cosmetic aspect, but we also do veneers to restore that wear. When teeth have worn down, the
Mhm.
bite isn't efficient anymore. Then we can kind of kill two birds with one stone in that we can improve the smile and improve a person's function.
Mhm.
So that, it's really just looking at each individual person and what they want, and then how can we deliver it?
Mhm.
And often veneers are a great way to do it.
Mm. Well, I've had veneers twice. I had them in our early marriage, and then I needed them again. I believe it was 15 years later.
Mhm.
And I've got 10. And would you say that, and I saw on your Instagram a beautiful young woman that I think you just did four veneers and then gum let's see.
Recontouring.
Yes, which I had that as well. That's a
Mhm.
huge thing.
Mhm.
And it's amazing the makeover. And so what's the average number, or it there may not be an average of how many veneers make a huge difference?
Well, I mentioned earlier that we start out in our studio. So I've got a full photography studio. We take
Mhm.
pictures at different angles, just a comfortable smile picture, and we look what's on display. So I talk a lot about that the lips are the curtains and the teeth are the stage. And so we sit down together and we look at what shows in that smile, and then we start to kind of look at what a person has compared to what they want.
Mhm.
And then obviously, I will point out different things that people may or may not realize. And a real common thing is the teeth in the back, because very often the teeth in the back, maybe they have old silver fillings in them, so they look dark or gray.
Mhm.
Maybe they have old crowns that are a different color.
Mhm.
Maybe a person's got a very, very narrow smile. That's
Mhm.
super common.
Mhm.
And so as we're looking at that smile, if the extent of what we can do is that broader area, we'll think more like 8 or 10 teeth. If their back teeth are, beautiful, then we
Mhm.
may focus on a smaller number.
Mm.
Now, I will say in most cases, somebody that's really experienced with veneers, we rarely will do the six front teeth. They call them the six social teeth,
Mhm.
which you show in a smile, because as soon as you turn your head, there's this discrepancy. And
Mm.
so I'll always point out, I've got to hide where your natural teeth stop and my work starts. I want
Mhm.
a smile to blend in and not just be those 4 teeth or those 6 teeth or those 10 teeth. So
Mhm.
I want to create a smile. I don't want to create a veneer look, if that makes sense.
Right, right, because there is a huge difference in what the old ones look like compared to the new, and how wide
That's
your
right.
curtain is. Some have they don't need
Yep,
as many, but
that's
and
right.
I will ask you, is it one problem that I had, and I've just wondered if you had a solution for it, is waiting on the veneers to be done, the temporary crowns. Oh my goodness, I had to go back twice because I can't keep a temporary crown in. Is that just something you just have to go back and fit? I would bite into a banana and my temporary would come out.
The process that I use, that's extremely rare. Okay. And so just to kind of talk a little bit about the process. So once we decide what we're doing, what's the scope of our job, so to
Mhm,
speak. So let's say we're going to do 8 veneers. That's a
mhm,
pretty common way to go.
mhm,
And so what I like to do at that point is I like to get my lab involved. So we will take photographs, measurements, uh, scans at this point, and send
mhm,
those to the lab. And we will basically mock up a person's new smile, even
mhm,
before we've ever touched their teeth. Okay.
mhm,
So that comes back from the lab, usually takes 2 to 3 weeks. That comes back. And then a person will come in for that sedation appointment,
mhm,
and we'll address the teeth that we're treating. So if it's
mhm,
the 8 teeth, we'll do whatever kind of modification to the tooth underneath that we need to do.
mhm,
And we'll put the temporaries on. We call them previews, or we call them test drives. So
mhm,
the previews are actually attached to each other and they're attached to the teeth.
mhm,
So we have this strong temporary. We've even had people get married in their previews before.
Oh, wow.
Because they're extremely strong. And again, I've got patients that come in from literally all over the world. And so I can't afford to have people's temporaries pop off
Oh, yeah.
because it's very inconvenient, obviously. And
Yeah.
so we
Okay.
will attach them, and then we'll actually use that to have an interactive dialogue about what's good, what's bad, what needs to be modified. So literally, you're involved in the process. And so once you've been wearing these for a little while and you say, I love this, I don't like this, what about the color,
Mhm.
and things like that. So we use this as this is our trial. And then once a person is thoroughly happy, we will take scans of exactly what they're wearing, photographs, measurements, and we'll send that to the lab. That's the template. So in other words, the patient and I have decided what their final smile is going to look like. The
Mhm.
lab is just the executor of the smile. They're
Mhm.
not making important decisions. And very
Mhm.
often I see that the lab is drawn into making a lot of important decisions that, in my opinion, it's not their place to make those decisions. It's
Mhm.
ours.
Mm.
That's how
Yeah.
we attach, or we approach the idea of this temporary phase.
Okay. Okay. So if someone listening or watching lives somewhere that's not convenient for them to come for their consultation, you do offer virtual smile consultations. Are you
We do.
able to get to the point of how far can you go in that consultation before you need to make the trip?
So we actually have two different remote platforms that we use. The one is the virtual, and I can, through that, I essentially will send kind of a one size fits all video along with a tentative treatment plan. Obviously, I haven't examined the person, so there are
Mhm.
things that I can't know or see yet, but I can give people a ballpark idea. Okay, and
Mhm.
that they can do from home. We also have another virtual consultation that's on the DoxyMe platform, which is one-on-one, so it's like a Zoom call. That is more specific because we're talking to each other
Mhm.
through that. And we've had a lot of our patients that have come through either both of those, to be honest with you. Once we discuss, and we also want to make sure that we're a good fit, right? We want to
Mhm.
make sure that what my approach is the approach that a person's comfortable with, because there are a lot of ways to do this.
Mhm.
Mine isn't the only right one, for
Mhm.
sure. And so I we'll discuss, and then we'll discuss next steps. And if at that point, that would be where we would want to do an examination and proceed with the initial steps toward helping a person with their smile.
Okay. I want to address something that actually Zane wanted me to ask. And I know many, many people, this is probably one of the most pressing questions people have is what is the quickest and easiest way to whiten your teeth? He's doing our daughter's wedding in like 4 weeks. And
Okay.
and I'm like, okay, asking this now, we've got 4 weeks. Talk to us about the cut through the chase because there are so many things out there. What works best?
No matter what, I would say a good thorough cleaning would be important, because there
Mhm.
are surface stains that are attached to the teeth that should be cleaned off. Okay, so that's number one. We offer several different types in our office, and over the years, the one that I have found to be the most predictable is core whitening. It's spelled Kor, and it is a kind of an old-fashioned tray type, but there's a lot of attention paid to the actual gel that's used.
Mhm.
It's sent to us packed on ice, because what we know, two things about whitening gels that are really important to know. Number one is, as soon as it heats up, it becomes active. And the ideal gel you want to place in on the teeth at the moment that it becomes active. because you'll have the most exposure to the gel, which will remove the stains the best. So that's number one. Number two is that in your saliva, there are a lot of antioxidants. Okay, that's a protective mechanism. And everything that we're using is oxidative, right? So the saliva is neutralizing it. So if you don't have a way to keep saliva out, your saliva is going to be working against you. So the core has figured out a good way to keep the saliva out and have active, so you have the most active time where you're actually whitening the teeth, removing the stains. So that is my favorite.
Is that
Most
in
of the
office? Is
it,
that in
well,
office?
you have to come in office to get the trays made, but
Uh-huh.
it's done at home at night. So for most people, 2 weeks. The other major concern about whitening is sensitivity. And there certainly are some types and techniques that are more sensitive than others. Core has a desensitizing protocol, which is very helpful to minimize that. I wouldn't say it's zero. For a lot of people, it's zero, but for some people, you can have some sensitivity, but most people are able to work through that and get the results they want.
And how long do
So,
they last typically?
so the trays last until you have like dental work done or some change to the teeth.
Okay.
And the actual gel itself, obviously you put it in the tray, so you use it up. But whatever you don't use, you can leave in the refrigerator for 3 years.
Oh, wow.
So
Okay.
it lasts. So I like core a lot, and especially like the person that you talked about, we're doing 4 veneers. Well, I want them to keep their other teeth light because if they start to change, the veneers aren't going to stain, but their natural teeth will stain. And so one night a month is all that's required to keep them at that same level, regardless of iced coffee or regular coffee or red wine or whatever, your staining thing, your favorite staining thing is.
Yeah.
So on the long term, it actually is extremely economical because you just buy the gel when you need it.
Well, I'm going to come. I'll send Zane down to get, because he doesn't have veneers. I think I'm pretty good right now, but I'm going to send him down to get that because he's got 4 weeks. So
Okay, sure.
he needs to get down there. I just want to address something that it's so basic. And I think you and I hit up on this when we were talking at church. Can you just tell us how important it is to floss? Because I mean, I notice when it looks like people need to floss. I don't always do the best job myself, but number one, what does that affect besides the way your teeth look and your breath? Just hit upon flossing.
So it's actually been estimated that after cardiovascular disease and diabetes, that gingivitis or some form of periodontal disease is like the third most common chronic illness that people are walking around with. Okay. So, and depending on, that's according to the CDC. So you could argue whether or not it's communicable. I think it is because the bacteria can be transferred between people. So gum disease and flossing are related to a bacterial infection. Okay. So you think about how long would you be comfortable walking around with a bacterial infection, right? Let's say it's, a sinus infection, an inner ear infection, a UTI, when we think about other bacterial infections, we wouldn't dream of walking around like that for a long period of time. But people literally, especially if they're not flossing consistently as in every day, probably very likely are walking around with a bacterial infection, a chronic bacterial infection. And so when you ask how important is flossing, it's extremely important because it's the only way to clean under the gum line between the teeth. There really isn't an effective way to do that's accessible to most people.
So, okay, a bacterial infection that's residing in your mouth, could that ever make its way somewhere and cause something like sepsis? Or, I
Sure.
mean, oh my
That
goodness,
it's
that
been
is so
related,
scary.
it's related to gum or to heart disease, I'm sorry, to heart disease, to stroke, to colon cancer. It's been linked to all of these disease processes that we know are bad. And it's the most easily treatable especially on the prevention side of things. So, and
Wow.
when you ask the question about how important, every single examination I do, I spend my time with our patients explaining and showing them how to floss. And I've been doing this for 34 years because I generally get the response, nobody's ever showed me that. Nobody's ever taken the time to explain it that way. And
Mhm.
so, and as soon as I feel like I'm wasting my time because everybody knows how to floss properly, I'll stop
Mhm.
doing it. But I had a physician this week that I showed her how to floss, and she said, nobody's ever showed me that before. It's very, very common that people don't properly understand flossing.
Wow. And that is a wake up call. I did not realize, I don't think people do realize that you're walking around with a bacterial infection
Right.
and that it can lead to oh my goodness, well, I'm going to get better. Now, do you think just the traditional flossing is superior to the any of the water, whatever, just the basic?
So I think that the basic flossing is the gold standard.
Mm-hmm.
Okay, as long as it's done properly. And by the way, I've got to mention this. I am not a fan of the floss holders and the picks and all of the different things that you can buy. And I explain this to people every day. So a lot of my conversation it starts after I've done a person's periodontal exam.
Mm-hmm.
So we've measured, so the gum is attached to the tooth a lot like your fingernail is.
Mm-hmm.
There's a portion, the pink part that's attached to the finger and the nail are attached, and then there's a portion that's not attached, like the white part of the nail.
Right.
And just like if you worked outside, you get dirt between your fingernail and your finger, there's a portion around every single tooth where bacteria hangs out. That's where it sits. That's where the infection is. So how you clean in that space is extremely important. So just like if you rubbed your hands together and you didn't intentionally clean in that area, that dirt is going to still be there. So, we have brushes and things like that. For the teeth, we use floss in the correct way to get
Mm-hmm.
underneath there. So getting back to the picks and the holders. Number one, the goal of flossing is to remove bacteria from the mouth.
Mm-hmm.
It's to disrupt the biofilm, which is the sticky substance that the bacteria sticks to, and to remove as much bacteria as we can. Okay. So what if you use the same one and clean between every tooth? Are you removing bacteria or are you spreading it around like washing your window with a dirty
Mm.
rag?
Oh my goodness.
Yeah.
Okay, yeah, that's making sense.
That's
Okay,
right.
do you have this somewhere, a tutorial on this?
I honestly, I've done it live for 34 years, so I really don't. I probably should because it's very helpful.
Oh my goodness. Well, that leads me to another question. Okay, so flossing, we've got the importance of that. Why do people have bad breath, and what is the way to prevent it?
Okay, so in most cases, there are several causes for bad breath, obviously, but the low-hanging fruit, if you will, is a bacterial infection in the gums. And also remember, the bacteria lives on your tongue and all of your oral, the surface of your mouth and around your tonsils. Okay,
Okay.
so I think the latest trend is to also think about brushing your tongue, brushing
Hmm.
the surfaces around your mouth as well, because there's bacteria there. You can use different mouth washes to address the tonsillar area. There are some that were developed at UCLA's halitosis clinic. That the BreathRx company is based on that research that was done at UCLA's halitosis clinic to get around the tonsils. But that's a way that you can kind of focus on those areas. But the simplest way is proper flossing consistently and brushing and removing that odor causing bacteria every single day.
So when we have bad breath or we smell bad breath, we are not smelling food per se. We're smelling bacteria that has not been flossed away or brushed and rinsed away.
Probably.
Okay. So it's really a sign of poor hygiene. Typically.
It often is. And the other thing too that's really sad is that there are a lot of people that I've seen over the years that floss every day, but they don't floss correctly. And it's essentially the same as not flossing at all. So the analogy I always use, imagine that every day in the shower, you clean from your knees up. You never ever touch your feet. You don't let the water hit your feet. And you go to the doctor, you take off your shoes and they say, "What's that smell?" And it's because you haven't washed your feet in forever. And same with the areas around the teeth that never get cleaned, even though a person feels like they're doing that. And unfortunately, if you floss improperly, it's essentially the same as not flossing at all.
Oh my goodness. Okay. Well, let me ask you this from a practical standpoint. Like I buy the toothpaste like Optic White or 3D. Is that a waste or is there a superior toothpaste for people,
There are different toothpastes for different applications. So for instance, a person that needs help with getting their gums healthy, there are some toothpastes that say like Total Care or Gum Care, something along that lines. Most toothpastes, obviously there are the very natural toothpaste, and then there are the other the more conventional toothpaste. Most of the conventional toothpastes have fluoride as one of the ingredients, and that's designed to make the enamel surface stronger, so it's more resistant to bacterial infection or decay. We call it cavities. And so that type of toothpaste is really helpful for helping to prevent cavities. Okay. So brushing with nothing, you would miss out on that. Now, some people have issues with fluoride and they choose, it's not really based on good science, but that's how they feel. And certainly there are some natural toothpastes that are also available without fluoride. So the idea is that just kind of pick your goal for brushing and flossing, and that's where that is. My personal feeling is that brushing away the bacteria is the most important part, but the toothpaste, especially fluoride toothpaste, does add a layer of protection for problems like decay.
Okay. Now I want to ask you this as well. I just started using a nice Oral-B electric because I was told that just manually brushing is not nearly as effective. Is that your opinion as well? That we need to be using an electric toothbrush?
I feel like most people do better with an electric toothbrush, and there are a few reasons for that. One is the head size of, like the one that you mentioned, is small and round. And if you think about the shape of the tooth coming out of the gum, it's small and round. So as long as you focus your attention like tooth by tooth going around, and it'll clean that area, because by the way, bacteria really likes to live next to the gum more so than kind of in the middle of the tooth. So that's the area that you really want to focus on. And most of the newer electric toothbrushes focus on that, especially the newer Oral-B toothbrushes. The other kind of part of the newer toothbrushes is that they also give you feedback on the amount of pressure that you're pushing on the tooth. I don't know if yours does, but the one that I recommend is the Oral-B, and it's called the IO. And what it does is, as you put pressure against the tooth, it starts out, there's a light on the handle that you can see in the mirror while you're brushing. And with no pressure, it's kind of a bluish color. When you have the right pressure, it's a green color. And when you're pushing too hard, it's red. And unfortunately, there are a lot of people that are putting too much pressure on when they're brushing, and they'll cause gum recession and can even cause some loss of the root surface if they're pushing too hard. So there's,
Wow.
I tell my patients it's Goldilocks green. It's just right. So when you're in that green zone, you're not doing any damage, and you're doing the most good.
Okay, I'm going to find that. I'm going to link to it for everyone listening, and I'm going to get that one because I have had gum recession, and that is not fun to fix.
Mhm.
Maybe at your practice where we're sedated, but oh my goodness, that is so unpleasant. So,
Yep,
so actually, and I remember I was at Auburn my first time I had to have it done. They said you are brushing too hard. So
that's
I
right.
did not know there was a toothbrush that would tell. Thank you. That's a huge tip. I want to ask you this, and I know I'm about to let you go. I know you've got lots of patients, but can you tell us, is there anything that we can rinse with that I remember, I think in high school, you could see where the bacteria was in your mouth because there was some kind of dye. Does that exist? And is it something that might help us to realize what's really going on and motivate us, to do things more consistently as far as flossing and brushing right?
Sure. That's actually a great question. So when I started dental school, I went to the Medical College of Georgia for dental school, and we were required to have, they would call it a plaque test, and they would use so those are called disclosing tablets, or they also have a liquid that you can rinse around after you feel like you've done a good job, and it
Mhm.
will stick to the plaque. Some of them have two colors. It'll look one way on new plaque and one way on old plaque. So it makes it so that you can see, because unfortunately, the plaque is kind of a whitish yellow, and if you
Mhm.
don't know what you're looking for, you really can't see it very well.
Mhm.
But we had to have a perfect score before we could take the class. So
Mhm.
you'd get like a 0 for the day if you didn't do everything that you needed to do. So
Oh,
that's when I learned how to brush and floss. So it's
so we can get those today?
yes, I think that they have them at just a CVS or Walgreens or similar type pharmacy type place. If not, ask the pharmacist because they can order it.
And they're called disclosing tablets.
Disclosing tablet, it's just a vegetable dye.
Oh, okay.
So it's not harmful. I wouldn't do it before a big date or something because it'll make your mouth bright red and
Oh,
that sort of
no.
thing.
Okay. Okay. Well, before I let you go, is there anything I haven't asked that you see over and over and over, and you think, I just wish if I could tell everybody one thing that I see them doing wrong or that they are not doing that they should? What's your biggest tip for the masses?
So the one thing that I would say, because I see this so often, so as I was thinking about, what do I do? I'm a problem solver,
Hmm.
and the emotional impact of problems in the mouth is something that cannot be overstated. And I'll give you some great examples is that, very often someone has had some kind of damage to a front tooth when they were possibly in high school athletics, for instance. They got hit in the mouth when they were playing basketball or something like that. And it was repaired. They were young, and they've just kind of kept this thing that really bothers them for a long time. They get embarrassed and ashamed. And so, number one, that I would say two things. I would say, number one, it's not your fault that is there, that there's something about your smile that just makes you feel bad, makes
Hmm.
you, here the test is that if you're ever posing for a picture with your family and you do not want to show your smile, that's probably the person I'm talking to. Okay.
Hmm. Yeah.
So that's number one. Number two, get it fixed because it will change. That's the most exciting thing that I get to do is change people's lives by
Hmm.
taking away whatever that thing is. So
Hmm.
don't put it off because the impact will not only affect you, but it'll affect everybody you interact with.
I love that. And I want everyone watching or listening to know that go to the show notes. I will have every link. Follow Coke, Cook Aesthetic Dentistry, KOCH. And then you'll also, we'll get links to your virtual consultations and every possible way to connect with you and your practice. Thank you. have a million more questions, but I'm going to have you back again and I think next time I'm going to let followers submit questions and we'll do a Q&A
Sure.
if you'll come back again.
I would love to. One of the most important parts of our vision statement for a practice is to impact the health and self-esteem of our community and our profession. And by doing things like this, I feel like I'm able to reach so many more people. And I know that you've got such a great audience. They I'm sure love listening to you and learn so much. I've listened to your podcast now and I've learned a lot. So
you're so kind. I like to savvy and wonderful people and resources, and you're definitely one. And I will be honest, as soon as we log off, I'm going to make an appointment because I've got some things and I've learned a lot. And I will say, I've had a wake up call and I really want to spread the word about that. And I would love to actually come to your office and with my little guy that videos and us make a proper flossing video. And you have it on your website, I'll have it on mine, because the fact that can lead to death and all of these, that has blown me away. Of everything we've talked about, that to me is the most convicting. So we'll do
absolutely.
that. I'll come down.
I would love to do that. That would be fantastic.
Okay. Well, thank you so much, Dr. Koch. I look forward to it, and you have a fabulous rest of your day.
Thank you. I'll see you at 8 o'clock on Sunday.
Yes, absolutely. See you there.
Okay. Bye-bye.
Bye-bye. Hi, everyone. I hope you enjoyed this episode of the SavvyCast. If you'll take the time to rate, review, and subscribe on iTunes, that would mean so much. As always, thank you for listening and have a blessed day.